Thanks very much, Wendy. Thank you very much for the introduction. So as Wendy mentioned, on this rainy May evening, we're going to go down the route of talking about urinary tract disease in both rabbits and rodents. I'm going to start with rabbits, and this obviously will be somewhat of a whistle-stop tour of a very, very broad topic. But as long as we can sort of encourage people to think about this as a differential, get the basics right, start using the cascade once you have a diagnosis, then I'll be very content with people taking away just that one message. So I wanted to just do a really, really quick whistle-stop tour through the anatomy of the rabbit urinary tract. And in common with every other mammal, we are talking about paired kidneys, ureters, bladder, and urethra. And I think the first point that I would like to make is about the kidneys. And unlike most other mammals, kidneys in the rabbit are unipapillate, which means that they only have one papilla and one calyx that enter the ureter directly. So this is not the same directly as other mammals. As far as the meat of the kidney, you are talking obviously about a medulla and a cortex and renal tubules and whatnot in the very similar fashion to other mammals. So that functional portion is not particularly different. Obviously the function is a little bit more similar to perhaps horses or cattle than cats and dogs, simply because rabbits are geared up to produce an alkaline urine. The other thing that is worthwhile mentioning here is that unlike other mammals, rabbits do not control the amount of calcium that is taken up from the diet in the gut. So all of this has to be excreted by the kidneys. And unlike sort of other species where you have an approximate sort of less than 2% of the calcium is excreted by the kidney, in rabbits between 45 and 60% of the calcium intake is excreted by the kidney. So they have to work very, very hard in that excretory mechanism. So that is in contrast to other species. As far as the structure of the ureters, the bladder and the urethra go, they are very, very similar to other species, and not, you know, they should be treated very much in a similar fashion and thought of in a similar way. So the structure is similar with the type of cell layers, with the bladder, the lining epithelium and the interstitial muscle, which works in a very, very similar way. And just to make certain that we know sort of topographically what we're looking at, I wanted to just very briefly have a look at a left-sided lateral view of the rabbit body. And this is a picture from Popesco, the Czechoslovakian version randomly that I have, and to just highlight what we need to be looking at, because this is going to become important when we talk about imaging. So if we look here, there's the kidney is here on the left-hand side, just caudal to the last rib, and the bladder just sits here at the pelvic inlet. And again, very, very similar positioning to other species. In the rabbit, the right-hand kidney, again, similar to cats and dogs, is slightly anterior to the left. Size-wise, the kidneys are approximately, just possibly a little bit longer than 2 rib spaces. And so physically, with the ultrasound, with the radiography, you are then able to kind of have an idea of what you need to be looking at. And physiologically, how are we different? So I think fairly similar in many ways to other mammalian herbivores. As I said, rabbits produce an alkaline urine. They're going to produce in the region of 100 to 130 mils per kilo of urine every day. And this becomes very, very important when we're looking at things like urinalysis, because that means that we have a very, very wide normal variation in urinary concentration. And the urine can be pretty dilute before we start thinking actually that is really not normal. And again, when we're looking at the physiology of the calcium uptake and excretion, as I said, this puts an awful lot of pressure on the kidney function, and particularly the active excretory function, trying to get rid of the excess calcium that is taken in from the diet. So rabbits are very, very reliant on good kidney function right from the get-go, and in a similar way to cats having a lot of functional pressure put on the kidney by the protein in the diet. If we think about rabbit kidneys in a similar way, they have a lot of functional pressure put upon them by the variation of calcium in the diet. And then if we think a little bit further down about the ureters, the bladder and the urethra, when we have a very, very high proportion of calcium in the urine, then this can affect the function and cause pathological change, or be associated, is a better way to put it, with pathological change in certainly the ureter, as far as the potential for ureteroliths, within the bladder, as far as the potential for calcium sludging within the bladder, as well as cystoliths, and also in the urethra. And high calcium levels in the urine is strongly associated with urethritis, although there isn't a causal mechanism proven. So we have sort of quite a broad overview, and what I would also encourage people to be considering at this stage is the fact actually that diet has a massive effect on the way that the kidney functions, and also the effects that the urine has on the other structures. So if in the wild the diet varies very much yearly with the amount of calcium, obviously less so in a pet population, but the amount of calcium in the diet, so you know, if you're feeding an awful lot of high calcium vegetables like coriander or kale or something like that, then that certainly affects the urinary calcium levels, and it affects the way that the kidney functions. So I wanted to just have a quick chat about the common clinical presentations that we see that will be likely to refer to urinary tract disease at whatever level. And I think the first thing to say is that it's all very well presenting various scenarios, but actually sometimes you just get a rabbit that just isn't okay. It just isn't right. It perhaps is in and out of gut stasis for no obvious reason. Perhaps it's a bit quiet. Perhaps it's lost weight. However, there are certainly, on further questioning, various more common scenarios that we see. And the first one that I see and sort of ask about a lot is polydipsia and polyuria. Is the litter tray wet a lot more than you think? Are you filling the water bottle up a lot more commonly than you think you should be? Is the rabbit seen drinking with its head hanging over the water bowl? Is it constantly mouthing at the water bottle? And in common with the urinary output, if you have a rabbit that's taking in significantly more than 100 to 150 mils per kilo per day or per 24 hours of water, then that is really definitely polydipsic. The reasons for polydipsia in rabbits are very similar to other mammals, but the one thing that I would highlight and add in is that rabbits with dental disease can be seemingly